Hi everyone, my name is Giang Thai. I am a research analyst at the International Food Policy Research Institute. Today I would like to present a paper on the economic cost of multisectoral nutrition intervention implemented through a credit platform in Bangladesh. This is the joint work with our amazing co-authors listed here. The paper is a cost analysis that applied a novel standardized approach called Strengthening Economic Evaluation for Multisectoral Strategies for Nutrition, or SEAMS Nutrition. First, I will talk a little bit more about SEAMS Nutrition Framework before diving deeper into how we apply the framework to our program. SEAMS Nutrition has two main objectives. First is to define most appropriate standardized methods for measuring cost and cost effectiveness of integrated multisectoral nutrition program. Second is to estimate the costs and benefits as well as cost effectiveness of integrated multisectoral approaches. SEAMS Nutrition has developed a common approach to guide the conduct of economic evaluations for nutrition, and it is comprised of four main stages. The first stage is to map the program to a standardized typology of multi-sector nutrition interventions. The second is to map the impact pathways, identifying the program benefits, list out all of the program activities, and identifying the input and costs that go into each activities. Third is to use the standardized cost data collection tools to collect cost data. And this is ideally can be done alongside with impact evaluation to document the evidence of program effectiveness. And fourth is to compare the program costs and benefits, as well as compare these results with other programs of similar approach. Now I will talk a little bit more about targeting and realigning agriculture to improve nutrition, or TRAIN. TRAIN is an ongoing project that aims to tackle the high prevalence of undernutrition among women and children in rural Bangladesh. TRAIN has an additive design that built on an existing credit platform that BRAC, our implementing partner, has been running for a long time. As you can see here, Arm 1 is a control arm with only microfinance program. Arm 2, the microfinance program, is complemented with nutrition behavioral change communication component delivered by frontline nutrition workers through household visits. And Arm 3, we have all of the components of Arm 2, plus the nutrition sensitive agriculture extension service delivered by frontline workers, also through household visits and community events. And Arm 4, we have all of the components of Arm 3, plus the gender sensitization components also delivered by frontline workers through household visits and community events. Now I will walk you through the 6 steps that we conducted to apply SEAMS common approach to TRAIN. The graph that you are seeing on the right is the list of standardized tools that SEAMS developed for projects to adapt to their own needs. At the first stage of the design study, we applied the economic evaluation matrix and the protocol that SEAMS developed to help us determine the scope of work for the analysis. In the second step, we identified all of the project activities and mapped them to SEAMS codes using the project activity tracking sheet. In the third step, we collect the qualitative data to help us estimate the economic costs. So we used data collection planning form, focus group discussion, and key informant guidelines to help us collect those data. At the same time, we also obtained the financial expenditure from BRAC, and we use the expenditure analysis model that SEAMS developed that is already incorporated SEAMS codebook to analyze the financial data. When we analyze the economic costs, we use the time allocation form that SEAMS developed to help us understand the time use of staff involved in the project. Once we have these results, we feed them back into the expenditure analysis model to help us break down the financial data into activities and input level. Then in the last step is when we have both the economic and the financial cost, and we aggregate them to be at the project level. What you are seeing here is the summary of our results. The total incremental cost of TRAIN from the period of October 2016 to April 2019 was approximately $522,000. This is equivalent to $138 per household, or $74 per beneficiaries. This is only considering the indexed household female and their spouse. When we break the cost down by the input, the main cost drivers are the personnel and travel allowances. Since train interventions relied heavily on a big group of frontline workers to deliver the messages to households, it makes sense to us to see that this is what takes the most cost out of the total cost. Then when we break down the cost by activities, the main cost components are from the household visits, both nutrition and gender components, and as well as agriculture components. On top of that, there's also site supervision and community events. These are the main components of the interventions. So it really highlights through the cost that this is what the train intervention is all about. Then when we break down the costs by treatment arms, the unit costs go from $83 per household in arm 2 to $140 in arm 3 to $191 in arm 4. As the program complexity increases across arms, the unit cost per household also increases. And what drives these increases are the personnel costs of additional activities. So this is a very brief presentation of our cost analysis that we apply SEAMS nutrition framework to the TRAIN program. Thank you for listening.